From the KHOU 11 studios, it's Great Day Houston.
It's time for Medical Hot Topics, and on our panel today, please welcome orthopedic surgeon Dr. Tarek Fall, dermatologist Dr. Sherry Ingraham, hormone specialist Dr. Stephen Hotze, and otolaryngologist Dr. Martin Sitardi. What is a otolaryngologist?
You're nothing pro, doctor.
Okay, ENT. That's why we call it ENT then. All right, please welcome them to the show this morning. So, as we know in the world of medicine, there are just all kinds of studies out there. And some of them we kind of look at and go, what? Others we look at and go, okay, that makes sense. And that's how we come up with treatments and cures and things like that. But what about this? Wearing a hairband on your wrist can make you more susceptible to infection.
It's actually something I see a lot because not only do I wear a hairband on my wrist sometimes and pull it back in clinic, but I do see patients where they have compression-related skin conditions. So if they wear a tight watch, sometimes they'll develop an infection under that watch or even a contact dermatitis.
You know, I find with my ring, if I keep my wedding ring on and I wash my hands, so it gets wet underneath there, and then your skin starts to get flaky and stuff.
Two things can happen. Not only will you leach out the metal, so if there's nickel in the hairband, you can have a little contact dermatitis, but also anytime you're putting compression on the skin is unable to breathe. The circulation is impaired, and when the circulation is impaired, if there's any kind of pathogens, bacterial or otherwise on the skin can't fight it as well, and then you're introducing that bacteria into the skin, and the skin can't breathe, and you can't wash it off, so it's a compounded problem.
Yeah.
And it's also a circulatory problem, right?
Right. There's issues of circulatory, but I think in order for circulatory to be a bigger problem, it has to be compressed significantly. And I think the average person would notice if they had significant compression that they would say, let me take this off.
You would notice if your arm is turning blue.
Right.
And then the numbness surely should say, oh, maybe that hairband's a little too tight.
Exactly.
Okay.
But abrasions can occur that can lead to infection because there's normal bacteria on our skin anyway to begin with. So a small abrasion can lead to that infection.
Okay. All right. And Sherry, I got to talk to you about this under the ring thing because it's causing problems. Okay. J.J. Watt. I didn't want to say anything about him. I just wanted to say J.J. Watt. Anyway, yes. Okay. So J.J. Watt, the team player that he is, played with a broken hand. This is something parents wrestle with a lot when they have athletes. When they get injured, they still want them to play sometimes, but you want to make sure they can play without further injuring themselves. Okay. So played the game anyway with a broken hand.
Well, there are different types of fractures. So not knowing exactly what the x-rays showed, it's hard to say, well, he should have played or shouldn't have played. It could be what's called an avulsion fracture, where a small chip of bone breaks off. Those are usually fairly stable, or a non-displaced fracture where the fracture doesn't shift out of place, which is usually a pretty stable injury, so the patient or the athlete can continue to play in that situation. Yeah. Now, if there's a displaced fracture, that's a different issue, but not having seen the x-rays, it's hard to make a diagnosis if he should play at all or not.
I'm just thinking that 6'6" of all that fineness, just one little hand. The rest of him can play, right? The rest of him can play. All right. Get well soon, JJ. Okay. Painkillers in a patch, and this just kind of comes down to there's different delivery systems for all types of things, especially medications. But they said that it will deliver a dose of ibuprofen directly through the skin is 10 times the amount of medicine than the ibuprofen pill. Are there advantages to this?
There's advantages and there's disadvantages. So again, you have to think about contact dermatitis. I do see a lot of contact dermatitis to different patches, to hormone patches. Sometimes we'll see them, the length that's left on the skin. I do worry about the dose because you're missing first pass metabolism this way, right? When you're also missing all the GI side effects, which is nice. But I do worry about the dose someone is receiving because ibuprofen in high doses can have some deleterious effects.
Right. I think a lot of us think that things like ibuprofen or aspirin are very simple, acetaminophen, but combined with some other things too can cause some issues.
Absolutely, but also all anti-inflammatories, whether it be given by tablet form or given as a patch, can put the kidneys at risk for injury, leading to renal failure. Also, even smaller likelihood, but also liver injury as well. So you have to be careful.
Alcohol combined with acetaminophen can cause a lot of problems for people. But yeah, the whole thing, well, my headache didn't go away. I took some aspirin a couple of minutes ago. I'll take some more, right? Like adding more on top of it.
Non-steroidal anti-inflammatories have been shown to increase the risk of heart disease. That's one of the serious side effects, and that's why Vioxx was taken off the market, which is a non-steroidal anti-inflammatory. And if you look up ibuprofen, as one of the side effects is heart disease.
Okay, so anti-inflammatory versus like an aspirin, which people with heart issues are oftentimes told to take like a little baby aspirin.
Right.
So they're different things.
Exactly.
Okay.
The thing about topical treatment, though, is that it could possibly reduce side effects because you deliver the drug directly to the
Right.
target, so the
Right.
total amount of drug may be less.
People who have stomach issues, ulcers, things like that can bypass that by doing the, okay.
In
So that's
theory.
why it's good to see your doctor, right?
Yeah, but I wouldn't say bypass it completely. There's still going to be risk for the GI system, but not as bad as taking tablet form.
Okay, all right. Talk to your doctor, people. Okay, seasonal aggression. Have y'all heard of this, seasonal aggression? A study found that females are more aggressive in the wintertime. And wait, but here's what I love about this. Because you know, they do this study and somebody just comes out and says that women are more aggressive. How do they know this? Well, they tested it on female hamsters. Like, what, they're on the wheel, like running even more the whole time? I mean, what? Okay, Dr. Hosey, you're a hormone specialist. Why would we be?
Well, I want to tell you what.
I think it's
that
because
was-
of Christmas
that-
shopping and all
well,
stuff, and we have to just.
Well, we
we're
can't
busier.
extrapolate from a hamster to a lovely lady or a wife or a girlfriend or to a mom. You can't do that. That was the most ridiculous study I've ever read in my life. I'm serious. I couldn't make hide nor all of us, as those physicians that deal with hormones, have dealt with millions of women around the country, so we understand. And everybody knows hormones have an effect on your life.
Right.
And as your hormone levels decline and become imbalanced, it can make you feel, get a host of symptoms. This happens in males and females as well. And by injecting and studying hamsters, why do we need to do that? We have plenty of we've got real live people that come see us every day, and we could do that.
I just think that, like, maybe Billy saw that his female hamster was getting a little more aggressive, and he wanted to know why.
Somebody got good government money for a grant to do that study.
But here's what they do say. They're hoping for further research.
More money.
Yeah, talk to Dr. Hotze. He'll tell you what it is. Okay. Bursting eardrums. We've heard a lot of celebrities who've had this issue, which means that normal people have had this issue. Ed Sheeran burst his jumping off of a yacht. Justin Bieber burst his after wakeboarding. So how common is that, and what do we need to be looking out for?
Well, it's not very common, but it certainly can happen. It's due to the pressure of the injury being delivered to the eardrum, which just ruptures.
Okay, so jumping off of a yacht. Sometimes I think I could see if the pressure changed a lot, but what changed?
Well, it depends how high the jump was,
Okay.
and that's going to
How
be a
it landed.
factor. And,
Yeah.
and the impact, there are a lot of variables, but it certainly can happen. Any type of head injury can lead to a ruptured eardrum.
Okay, speaking of, we're in the travel season, and a lot of people, sometimes you get on that plane, you have that cold, right? The kind of head cold and stuff. So your ears can already have that pressure and pop and hurt, but it really hurts when you have something like that going on. When that's happening, is there a fear of bursting eardrums, or is that just pressure that we can withstand?
Well, certainly if there's infection, the eardrum could rupture in that circumstance. But usually if there's no infection, it's just negative pressure, and the pressure will equalize typically when you land again.
Yeah, all right, and the best ways to get rid of that, like, you land and you can't hear for the first 2 days? Yeah. I did that once when I flew to New York in contract negotiations. I was like, what? How much you pay me? What?
It almost always goes away on its own within a couple days. You can try some over-the-counter topical nasal decongestant. Try to clear your ears. Most patients can do that deliberately, and it should get better within a couple days.
All right, okay, now this next study, it's just kind of piqued my interest here. It says, can working out in the dark make you lose double the weight? All right, so working out in the dark, you mean midnight aerobics? That's what we call it at my house. Okay, people were taking boxing. We have children in the audience. I have to bail this. Okay, yeah. Working out. 1, 2, 3, 4, 5, 6, 7, 8. Okay, they said that people were taking boxing classes in the pitch black, and they seem to have just lost more weight and burned more calories. Okay, it says it removes the ability to judge yourself in the mirror, and you can focus on the workout.
That's ludicrous.
Not all at once.
That's ludicrous.
No, I think as a woman, sometimes when you go to the gym, you can be a little self-conscious, maybe men too, and perhaps a lower lighting situation. And I know they have a lot of spinning classes
Right.
in darker rooms, and people have this cathartic experience. They're very emotional. I've heard people crying. I feel like it's maybe safer. You're on a bike, boxing in the dark. You may
Yeah.
run into a wall or
Right,
something.
right.
But I guess it may remove that self-conscious. I would go to sleep, so it probably wouldn't work
Yeah.
as well for me.
Well, girl.
Hey, you know, I was thinking, if you're telling me women go in and ride bikes in the dark and start crying and have catharsis, That may be a hormonal problem.
There you go.
Well, all I'm saying is that, like, if you can, like, double the calories burned, honey, get ready. We're gonna.
trying.
Yeah. Okay. Okay. This last one here. Larval therapy. Tea bags are filled with maggots to help heal chronic wounds, ulcers, bed sores, stuff like that. This sounds like something that goes back in time that they may have done at one time, but kind of there's some science behind it, but not something that we should probably all jump on right now.
Well, I saw an example of that when I was in residency in Philadelphia many years ago. It was in underserved area in North Philadelphia. Patient came in, had an amputation of his leg, had his leg covered. We took the dressings off, and maggots fell out of his wound. So I saw that in real life, and we all jumped back, and then we admitted him to the hospital, removed all the maggots. Within 6 to 12 hours, he was septic or very sick because the maggots were keeping his infection at bay. So he got even more sick. Eventually, we had to take him back to surgery again, but they are very helpful.
Huh.
Yeah.
Okay. Well, so the maggots are what kind of slow down the progression
They debride and they remove dead tissue, and that could be a problem.
Okay. Well, I'll look at maggots in a different way now.